I think many people are familiar with lutetium-177 radiolabeled J591, because that's what the term has been for a couple of decades, now called rosipatamab. Those are studies that were done in New York, mostly at Weill Cornell and Morris and Kettering. Now that drug has been licensed to a company called TLX, so it's now called TLX591. It's being developed in a similar disease state to PSMA-4, Splash, Eclipse, et cetera, in that post-ARPI, pre-docetaxel for CRPC. They could have received it in hormone-sensitive disease. But unlike those other trials, there's some differences. So number one, the drug is different. So the biodistribution kinetics are different because it's an antibody rather than a small molecule. But it's a dose-dense regimen, so the entire treatment is on day 1 and day 15, 2 weeks later. So that's the entire treatment with the therapeutic radionuclide. And it's a combination study rather than just a head-to-head with second AR. And then I'd say at least as important as that is also the inclusion of docetaxel in the control arm. So it's second ARPI or chemotherapy that's decided up front and is a stratification factor, with or without the lutetium rosipatamab product, looking for the primary endpoint of radiographic progression-free survival with a key secondary endpoint of overall survival. It has a run-in phase, just looking at dosimetry and safety with the combinations. That part is basically done and is moving on to I think it's 490, but approximately 500 patient randomized phase 3 registration study.